So I wanted to make this video about a gum graft because I was so nervous before the surgery, and I barely saw anything online that gave me some comfort or eased my anxiety. So I wanted to put this out there for anybody that is going to have a gum graft or considering a gum graft. So as you can see, I'm very swollen on this side. I had my surgery yesterday. And the reason I got this gum graft is because I have a lot of recession in my gums. And if you leave gum recession, as you get older, there's a possibility that you're going to lose your teeth and have a lot of problems, like some family members of mine who never wanted to get the surgery because they were afraid. So today is Friday, and I had my surgery yesterday at 9:30. I did 4 teeth, and they took tissue from the roof of my mouth, and they cut open my palate up here and put it into my gums on the right side. As I said, if you're thinking about having a gum graft or you are scheduled for one, it's really not as bad as everyone said. I was really scared before because I was told that it was more painful than childbirth, which I kind of didn't believe, but that is not true at all. So I'm just going to walk you through what I experienced. The thing for me that was hard is they left me in the room for 45 minutes before my surgery. And I had everything hooked up to me as far as the heart rate machine and the blood pressure machine, and he was running a little late. So my suggestion is that for me, I did a lot of prayer and meditation, and I thought positive thoughts like I'm healing fast, and this is going to be easy for me. And I think that your frame of mind is really important before you do anything. So I did a lot of that, and I felt really surrender and acceptance before I started. So I was put under conscious sedation, which means that you're not completely under. So for me, medications don't work in my body as they do on others. So I was actually awake for most of the surgery, but I was so relaxed that it didn't really matter, and it went by really fast. I think he worked on me for a few hours, but that part didn't hurt. So as far as that went, that was fine. And then I woke up completely, even though I wasn't really sedated, and went home. And this whole area in here was totally numb. And if you can see, I have a retainer here. And so it's really important if you see your periodontist that you ask them post-surgical if they're taking tissue from the roof of your mouth, that they have a device to cover the roof of the mouth, because I hear that that's the most painful part, is the pain from where they actually take the tissue from the roof of your mouth. So just make sure, whoever you see, that they don't just give you tape to tape the area that they're cutting. They actually give you a retainer. It's like a little clear plastic retainer, and it's covering the part that they took from the roof of my mouth. So I was really numb, and I took the Advil. The most scary part for me was when I thought the numbness would wear off. I was not able to eat any solid food. So make sure that you have really healthy nutrition-packed food, like mashed bananas, butternut squash, yam, cut up yam, anything that's soft, like soft oatmeal, applesauce. What's really healthy is kefir, whole milk, organic kefir is nutrition and probiotic. So I know I've heard some people that eat like ice cream, which is fine, but for me, if I'm going to be eating and my body's recovering from surgery, I'll have some ice cream, but I really want to eat nutrition-packed food. So just make sure that in your refrigerator you have very soft food, or maybe some vegetables prepared that are very soft. You can eat soup, but the soup can't be hot because it can burn the graft, and you'll only be able to eat on this side of your mouth. But again, the most important part of the surgery is your attitude towards the surgery. So if keeping a positive state of mind is definitely helpful. Also having someone there. My husband took care of me, and my mom actually came over, so that was helpful. You'll be really, really tired from sedation. I have to say though, the pain was so much better than I thought it would be. I just took one pain medication. At one point, when the numbness starts wearing off is when it starts getting a little bit sore. It's really important too that you don't look at the area, which was not explained to me, but I kind of did my own research. If you pull this area to look at your gum graft, you can pull the stitches. Another tip that was really helpful is the only thing that's really bothering me right now is I have 4 gum grafts, so not just one, and so there's lots of stitches in my mouth, and the stitches are prickling out and touching my tongue every time I talk. Like right now, it's to the point where it's kind of making my tongue bleed. I don't want to show you because I don't want to ruin the graft. So I'm going back this morning, and they're putting something called periodontal tape around my stitches, on my stitches, so the stitches don't hit my tongue. So again, the thing to remember, the 2 most important things is positive mental attitude, well 3, that you have that retainer to cover the burn, because they're taking tissue from the roof of your mouth and putting it into your gums, so you want that area covered. And then, so far for day 1, the other tip is that when you leave, you ask if they could put periodontal tape over the stitches so the stitches don't hit your mouth. So that's the advice I have for day number 1, but I slept last night. I woke up once to take my pain medication, and I'm actually going to my daughter's school today to see a project, and I'm just so happy that the worst part is over with, and I will keep you my progress up. I will keep you posted on days to come, and also I'm a big yoga gym person, and so they crossed out 3 days for me and put 5 because they know I'd probably be there on day number 3. So I think I'll be able to work out day number 5. And so I got the surgery Thursday, and I'm going back to work on Monday. So I was concerned that I wouldn't be able to talk, but as you can see by this video, I'm definitely able to talk, but now I'm making myself smile, and you don't want to smile when you've had gum graft surgery. Anyhow, it's way better than I thought it would be, and I hopefully gave you some hope with this video, and I will keep up my progress and let you know more. Okay, hopefully this gave you some hope. Don't be too nervous. Just keep a positive mental attitude. Surrender. Make sure you have a really good surgeon. And one other tip, I took arnica, 200 cc's prior to the surgery, and I've been taking arnica every 3 hours under my tongue. It helps reduce swelling, because the painful part in gum graft surgery is the swelling. So the more swollen you get, the more painful it is. So you've got to make sure to take your Advil. I take 600 milligrams of Advil every 4 hours, plus the arnica. And I took the arnica prior to my surgery. Okay, I'll keep you updated with my progress. Thanks.